Hello. Today we'll be filling the HDFC Ergo reimbursement claim form. So this form needs to be filled out in case we went to a non-network hospital, or in case, let's say, the cashless claim was denied due to whatever reason and we'd like to try for a reimbursement claim, or we are filling the pre and post hospitalization expenses. So yep, moving to all the options which we have, all the fields and how to fill them. So the first and the foremost important thing is to have the policy document handy. So if you don't have the policy document with yourself, you can ask your claims manager to share the policy document. And now in this video, I'll just let you know how do we exactly fetch the details, right? Fetch the details which are required to be filled in this form from the policy document. So to begin with, the first field which we can see is the claim number. So this is required only in case of a pre and post hospitalization claim, not otherwise. So assuming it's the main hospitalization claim, we'll just ignore the first one. Moving to the policy details, we have the first one, which is policy number. The policy number obviously is mentioned all over the policy document. So if you just come to the second page, you'll be able to see the policy number right here. Okay. So we'll just fill in a random number. Okay. Then we have the policy start date. So policy start date would be mentioned right under this period of insurance. So from, let's say in this case, it's 11th July 2023 till 10th of July 2026. So we can mention the same, 11th July 23 to 10th of July 2026. Okay, this is 10th. Yeah. Okay. Apart from that, nothing else needs to be filled in this section, which is the policy details. Moving to the next section, which is personal details of the employee / proposer. Okay, so since it's not a group form, it's not a group insurance, sorry, it's a retail health insurance plan. So obviously it's the proposer and not the employee. And again, many people have this confusion key whether I need to fill in the details of the patient or the proposer. Okay, so if both are the same, then yeah, there is no confusion. But generally what happens is that the proposer is a separate person and patient is a member in the plan. So when you come to the second page of the policy document, you can see this in the fourth line in this section, policy holder name, right? So this is the name of the proposer. It can be also found right on the first page. The policy document is addressed to the proposer. So yeah, in this case, we'll just mention the name of the proposer. I'll just mention my name. Okay. Then again, this is not relevant. There is no employee number, so that's why you can't edit it. I haven't added any sort of editable text box here. Then we have the date of joining. So this is found right here, right? So the period of insurance, right? This date, 11th July 2023, would be the date of joining, because let's say for example in this plan, as you can see, Mr. Shravan, he was enrolled into the plan, which is the first policy inception date, on the same date as this one. But it is possible that the first policy inception date might be prior to the current one, right? So the current policy document might be 2023, whereas we have been enrolled into this plan since, let's say, 2020, right? So it need not be the same, but since in this case it is the same, whenever we enroll into the plan for the first time, right, or this issuance date would be the date of joining, right, of the proposer, not the patient, the proposer. Okay, the contact number of the proposer, I'll just mention a random number. Then we have the email ID. It could be okay. Then the occupation, again, this is all for the proposer, not for the patient. So occupation need not be very specific. You can just mention it either as service, business, homemaker, or it could be student, right, whatever it is. Then the residence address, this can again be found in the policy document, though it's on the second page. I have kind of blurred it out, right, but you'll be able to find the address right here. So the same address needs to be mentioned in this column, residence address. Then we have diagnosis. Okay, so diagnosis is for the patient. What was the reason for hospitalization? What was the ailment? It could be, let's say, for example, dengue fever. It could be viral fever, flu, or it could be, let's say, a cataract surgery, knee replacement, or let's say anything critical like cancer. So it could be anything, okay, based on what the reason for hospitalization was. Then we come to the next section, which is patient details. Here we'll be mentioning the name of the patient. Let's say, for example, it is Rohan. Okay. Let's say I took a plan and Rohan is my son, and this claim is for Rohan. So name of the patient will be Rohan. Okay. Relationship to the employee or the proposer would obviously be child. So I'll just type it out here. Okay. It could be that the patient is, your parent. It could be your mom, dad, right? So you can, in that case, you can just mention parent here. Okay. Then date of birth of the patient. Let's say, for example, if it's a child, I'll just mention the date of birth as 2020. Age in years, so this would be around 4 years. So I'll just type in 4. Gender, let's say male. Then again, claim details we need to mention the same ailment or diagnosis once again. Okay, that will be fever, or I could be a bit more specific. I could write it as dengue fever. So this can be found under the diagnosis section of our discharge summary. So discharge summary is a document which we get in case of hospitalization, and there we can find this diagnosis, and whatever it is, you can just literally copy paste it. Then coming to the next sentence, which is claimed from other insurer. So again, it's basically referring if you have already claimed from some other insurer and would want to claim for a part of that, whatever was not covered, let's say deducted amount. So in this case, let's say it's no. So I'll just put a Y here, that is yes to no. So again, it is possible that you might have your company insurance, your corporate insurance, you might have claimed a chunk of it, a part of the amount from that, and we are claiming for the deduction amount from a retail insurance. So it could be yes in that case, but since I am not claiming from any other insurer, it will be a no. So I mean, if it is yes, then I can just mention the details, right? Details being the name of the the insurance company. Then what claim am I filing for? Type of claim. Okay, so generally we have these 3 types: hospitalization, pre-hospitalization, and post-hospitalization. Hospitalization quite literally is the duration of the hospitalization and the expenses incurred within that duration. So let's say I am claiming for hospitalization, I'll put a Y here. Let's say I'm also claiming for pre-hospitalization expenses. So under pre-hospitalization expenses, we can claim for doctor consultations, we can claim for the tests, right? Let's say, for example, I had to go for a dengue test, or if let's say I had taken any medications on an outpatient department, right? So I can claim for that. I can also claim for the same which were done after hospitalization. So the medicines, the doctor consultations, and also the tests, right? I can claim for both pre, that is prior to hospitalization, and post, that is after the hospitalization. So again, in this case, I'm filing a claim for all 3 of them. Okay. Then we come to the next section, which is expenses incurred details, treatment cost details. So you can see there are almost 7 options here. We need not fill these 4. We just need to fill in these 3: hospitalization, post-hospitalization, and pre-hospitalization. So basically, let's say, for example, I got admitted on the 10th of August. Okay. So I got admitted, or let's say in this case, my son Rohan got admitted on the 10th of August, and they were hospitalized for 5 days. That is from 10th of August till 15th of August, let's say 16th of August. So the hospitalization period would be for 6 days between 10th to 16th of August. So all the expenses which I have incurred during these dates, 10th to 16th, will come under hospitalization expenses. So let's say 6-day hospitalization costed me 90,000 rupees. Okay. So this will come under hospitalization expenses. Any expense which I have incurred before getting admitted will come under pre-hospitalization expenses. Okay. So it could be a period of 5 days, 6 days, like depends, right? So it could be 15,000 here, for example. Okay. And similarly, any expense which I have incurred after taking the discharge, that is after 16th, or let's say after taking the discharge on 16th, right? will come under post hospitalization. Let's say it is the same. Okay, so now if I were to total this, it will be 30,000 plus 90,000, that is 1,20,000. Okay, this is done. Coming to the next section, this is something which we need not fill. Again, the reason for that is back in the day we used to send out physical documents, so we need to check, right, what all we are mailing. But again, since we are sending the scanned copies of the original document, we need not fill any of this. Then at the end we need to fill in the date, so I'll just put in today's date. Okay. And then the signature. So you have some sort of online PDF editor, you can just put in just paste an image of your signature right here. Okay, so this is how we fill the HDFC Ergo reimbursement claim form.